Hi students, welcome to the next session in oral pathology. We are discussing about salivary gland tumors, right? So in this video, we will discuss about adenoid cystic carcinoma. Adenoid cystic carcinoma is very favorite malignant salivary gland tumor for exam actually. And I hope you are very familiar with this adenoid cystic carcinoma because you may have heard about this famous. What comes to your mind when you say adenoid cystic carcinoma is Swiss cheese pattern, right? Swiss cheese pattern, right? That is the one you remember, I think, from your UG. Okay, so we may have studied in UG and we remember a few things about this topic, right? Now let's see what is there in adenoid cystic carcinoma. What are the things you should learn or you should consider in adenoid cystic carcinoma is that, see, adenoid cystic carcinoma usually comes in the minor salivary glands, most commonly in minor and major salivary glands. It will come 50% of the cases, it comes in the major glands, and 40 to 45 percentage cases it can comes in the minor gland. So it has an equal proportion, right? It can come in both major and minor salivary glands in an equal proportion. And there is one interesting question regarding the adenoid cystic carcinoma according to its occurrence, that it will come in major salivary gland, but if you talk about submandibular gland, the most common malignant salivary gland tumor that comes in submandibular gland, coming in submandibular salivary gland. Okay, so if you take submandibular gland alone, I'm ignoring the parotid, I'm ignoring the sublingual. If I take the submandibular gland alone and I see that, okay, which tumor comes more in the submandibular gland, I can see that it is adenoid cystic carcinoma. Okay, adenoid cystic carcinoma. Adenoid cystic carcinoma is the most common malignancy that comes in the submandibular salivary gland. Okay, that is one interesting question they have once asked. Okay, and it is just a line given in your navel. Okay, they have picked up that line and it was asked in a question. Okay, now what is the other things you should learn here? This is a malignant salivary gland tumor. This is very malignant, so you should know all the features of malignancy, right? So far we were discussing about benign salivary gland tumors, where benign salivary gland tumors are slow growing, so malignant tumors are fast growing. Benign salivary gland tumors do not spread much, okay, but malignant, they will spread faster. Okay, there will be features of pleomorphism, mitotic figures, etc. in malignancy. Okay, so there is high pleomorphism. Okay, the pleomorphism is there. Pain is there, symptomatic. It will be symptomatic. While benign tumors, it won't be much symptomatic. So in the question itself, they will give you pain in the region. Nerve involvement means the patient will have a numbness in that area. Okay, loss of sensation, numbness, all these are seen by malignant tumors. Okay, so it will be more symptomatic. Malignant lesions will be more symptomatic. Okay, that is one other thing you should know. Now if you see the histopathology, I told you adenoid cystic carcinoma is monophasic or biphasic. It is a biphasic tumor. It has both your ductal component and your myoepithelial abluminal component. Okay, myoepithelial cells. So both ductal and myoepithelial component is there. So it is a biphasic tumor. So when I say biphasic tumor, I hope you understand, because you have seen the first video of our introductory class where we discuss the basic terms. Okay, ductal, myoepithelial, luminal, abluminal. Okay, and the striking feature of adenoid cystic carcinoma is that the arrangement of these cells, the architecture. Now I hope how you study. Okay, we are not by hearting things. We are studying in a proper systematic way. First we saw the cells, we learned about how the types of cells are, what we saw the cells, and we know that salivary gland, how to study salivary gland, we should know the cells as well as architecture. Now what type of architecture they have? There are three types. One is you have classical pattern or the cribriform pattern. That is what you are saying, the Swiss cheese pattern. That is your Swiss cheese pattern, the cribriform pattern. So how the cribriform or classical pattern look like? They will look like so many holes, just like a Swiss cheese. Okay, I hope you are fans of Tom and Jerry, right? You may have seen Tom and Jerry, and you may have seen that Jerry is trying to steal a cheese. Okay, and have you seen the cheese that Jerry is trying to steal? It has holes in it. I will show you the image. Okay, I hope you saw this videos, Tom and Jerry, and you see where Jerry is sitting. He's sitting in the hole of that cheese. That is Swiss cheese. Okay, this is a Swiss cheese where you have so many holes in this. Now, similarly, see the histology of your adenoid cystic carcinoma. Okay, just like this, you compare the Swiss cheese with this area. Okay, of your adenoid cystic carcinoma, you can see so many holes. Okay, that is all cystic areas. Okay, small cystic areas. Cystic areas that are formed by the ductal cells, and around the ductal cells you have myoepithelial cells. So that's why it is biphasic. So you have this cells. These cells here, they make that ductal areas. And what's the peculiarity of these cells are they have a very dark nucleus with a angulated nucleus. We say angulated nucleus. Okay, the cells have cells. These ductal or myoepithelial cells, ductal cells have a angulated nucleus. The angulated nucleus is a feature of this ductal cells. So that is the first pattern, the classical cribriform pattern or Swiss cheese pattern. What other pattern they can take? They can take a tubular pattern, like tubes, or you can take a solid pattern. Means it's a complete sheet. Okay, so adenoid cystic carcinoma itself is a very bad tumor. You know, adenoid cystic carcinoma is very aggressive, very much high chance of recurrence. Okay, and it is I think in my experience itself, I have seen adenoid cystic carcinoma which has recurred, okay, within 5 years. And I have a case. I saw a case of adenoid cystic carcinoma where the patient had metastasis till the brain, and okay, so it is such deadly tumor. And even in this, the classical or cribriform cyst pattern, tubular pattern, solid pattern has the worst prognosis. Okay, worst prognosis. And if a person is having solid pattern, there is 100% chance that it will recur. 100% chance of recurrence. That bad is a solid pattern of adenoid cystic carcinoma. Okay, now what else you can see in this adenoid cystic carcinoma? There is a interesting feature. It is called perineural invasion. What is perineural invasion? PNI. Perineural invasion means when a nerve is going in that region. Okay, if a nerve is going in this region and I have a tumor here. Okay, so this is my tumor and this is the nerve. Okay, this is a tumor. Now what happens is that when the nerve is going through the tumor, our neural cells will attack, the tumor cells will attack the nerve and it will invade the nerve. That is called a perineural invasion. The tumor cells invade nerve. Okay, now there is another interesting phenomenon shown by this adenoid cystic carcinoma is perineural spread. Okay, this term you may not have heard. Perineural spread means this tumor cell, it not only invade, it will go through this nerve, it will travel through this nerve and it will make a new tumor here. Okay, it will travel through the nerve. That is called a perineural spread. Okay, perineural spread. So I have in my experience, there was a case of parotid gland adenoid cystic carcinoma, and the adenoid cystic carcinoma tumor cell, they have invaded the facial nerve. The patient had symptoms of facial nerve palsy and all, and this facial nerve, it was traced back. It was involving the nerve till the base of the skull. Okay, till the base of skull, the tumor was going through the nerve. So the surgeon had to dissect till the base of skull and take the nerve to do the neurectomy. Okay, so that was the case. Okay, perineural spread. The tumor may be in the parotid, but it has invaded the nerve and it gone through the nerve. Okay, so that is perineural spread. I hope this is clear to you. So adenoid cystic carcinoma show perineural invasion only. Adenoid cystic carcinoma show perineural spread only. Adenoid cystic carcinoma show both PNI and PNS. So that is the answer. Okay, adenoid cystic carcinoma show both PNI and PNS. So I am discussing this based on the previous questions. I hope adenoid cystic carcinoma is clear to you. You please remember this image. This is a IBQ image based question. Okay, so it is, I think it is very easy to identify. Just imagine just see the cheese pattern, Swiss cheese pattern. Okay, I hope it is clear to you. See you in the next video with a new topic.